So you can start. You can start talking like this.
Right.
Hi.
Hi, everybody.
So today we are doing our summer treatments, right? For the body
Treatment.
treatments.
Well, let's introduce ourselves first.
Okay, so I'm Giovanna. I'm one of the estheticians here. Nice to see everybody.
Hi, I'm Louisa. Also an esthetician. I've been with Arbitrati since 2010. And we do all the treatments here
Med
that
spa.
are med spa and that are non-surgical.
Yeah, 1 second.
So today we're going to be talking about body treatments that we can do during the summer or the rest of the year as well. Okay.
So top 3 summer body concerns that we all know is stubborn fat, low muscle tone, and cellulite.
Yeah, so most people have some areas of stubborn fat on the body. For some people it's their inner thighs, for some people it's their flanks, and other people it's their arms.
Or right under the butt,
Or
that
under the
little
butt. Mhm.
the saddlebags.
Mhm.
Mhm.
So a low muscle tone, it's really difficult maintaining muscle tone as you get older, and even when you're young, it's hard to maintain
Yeah, of
muscle
course.
tone. Because muscles over time degrade, and it's a struggle to keep your body toned.
Yeah.
Cellulite also that's one of the difficult conditions to treat,
Yeah.
because cellulite just shows up for women anyway, on the thighs, on the butt, and it's just very hard to treat. It affects 90% of women. Yeah, and you could see some of the areas that we talked about. So the top right is cellulite, all those little dimples that look like cottage cheese. That's my arch nemesis. So we actually have a few new things that we're going to talk about that treat cellulite. We're going to talk about some of the older things that didn't work too well, and we're going to talk about some of the newer things, as well as how to reduce some body fat and
Tone muscles.
and tone some muscle. Okay.
So the methods to sculpt and tone your body. So medically supervised diets, injections. So basically what Louisa was just saying, there's so many ways we could treat everything. And of course you can do everything, each one, to get the best results. That's always the best route to go. So we have patients who start on our Nouveau diet, which we'll get into, and we'll start, with the Coolsculpting, and then finish off with an Emsculpt. And let's say if there's stubborn cellulite that is left behind, they can always do injections to help reduce them as well.
And these are all things that we're going to talk about today that have minimal downtime, which is really important when you're busy, you're working, and you don't have time to take off.
Yeah, the surgery, we all know surgery is a long recovery, and there's some people who are just not against surgery and want to do something else, and that's when we come in and here to help.
So reduced fat options. These are our non-surgical options. We have our Nouveau diet, which is an intensive diet. It's a 40-day program, and then there's a little bit of a maintenance afterwards, which you could lose 25, 30 pounds.
Up to 40.
Up to 40 pounds.
Yeah.
In that time.
It's definitely a dedication. And but the thing with Nouveau diet, you're not alone. It's a supervised program. So somebody's always going to be talking to you. Somebody's always going to be reaching out. So a lot of times we do diets and it falls through because we don't have that person kind of pushing us through, but we are definitely there rooting
Yeah,
for you.
We're gonna talk more about that in
Mhm.
a later slide. Also, we have the Coolsculpting, which has been around for quite a while. About 10 years we've been doing it here. And one of our newer machines is the Emsculpt Neo, which is a radio frequency
And high fem.
and high fem, thank you,
Mhm.
to help, not only to help build muscle, but it also helps with fat reduction. So the Nouveau diet, do you want to
Yeah,
talk about the Nouveau
Sure.
diet?
So this is the only fully supervised program like we were talking about before. So you could lose from 20 to 40 pounds in little as 40 days. The Nouveau diet is all natural, no hormones, and it just helps our patients get the best results. And like I said before, as long as you're dedicated, you will see the best results ever. You just have to be fully committed to the Nouveau diet. And it's amazing. You drop weight really quick. 40 days is a month and 10 days.
Mhm. So when you come in, you would see our PA for the program. She would go over the whole program with you. And sometimes we do a hair test. And we give you some herbs or minerals that help speed up the process for detoxification. Coolsculpting. Coolsculpting is a great treatment that we have that actually just debulks your body. And we can actually shape the body with it's a customized treatment that we can put in different areas to help give the outcome that we want. Some people need more sculpting, some people need more debulking, and it works very well for the abdomen, for the flanks, the back. It works on so many areas.
Yeah.
Generally,
arms, saddlebags, flanks, abdominal, everywhere.
yeah, it's generally if you can grab the area and you can feel that fat in the chin, you can Coolsculpt it and it'll reduce anywhere between 20 to 35% of whatever gets put in that handpiece. It's a nice treatment. There's absolutely no downtime. And you can do the treatment one day and then that same night, you can go about your business. You can do anything that you normally do the same day.
Yep.
So here's some before and after pictures of Coolsculpting. The woman that you see on the lower bottom right-hand side, actually I treated her myself, and she did a lot of cycles. So we treated her many different times. And she really would have been a candidate for an abdominoplasty, but she wasn't healthy enough to have an abdominoplasty. So we did the Coolsculpting instead. And she went down quite a few dress sizes.
Yeah.
I think she said she went from a size 20 to a size 12.
Wow.
So that was a big.
That's 8.
Yeah,
sizes
that's
down.
8 sizes
God.
down. Yeah.
Yeah.
But like I said, you don't, I mean, generally, if you are, if you have some bulk, it's perfect for you. The people who are not really a good candidate is people who have loose skin.
Yeah.
Because it's not going to take away loose skin. It's not going to make loose skin, but it's not going to take it away.
So basically, Coolsculpting is a non-invasive fat reduction treatment, just like Louisa was saying. This FDA cleared treatment offers a solution for healthy adults with stubborn fat and bulges. So what it does, it freezes the fat with the handpiece, and it basically shrinks those fat cells. And what happens is you lose it through your lymphatic system. So through your sweat, through the bathroom, that's where it all goes. So, it's like a good detoxing type of.
Yeah. Well, it actually kills the fat cells because you're changing the actual structure of that cell. So once you freeze that fat cell, it's not in its natural state. So it ends up dying off.
Yeah.
So that's how it actually reduces the fat. So it's not just making it smaller, you're actually killing those fat cells, and it comes out through your lymphatic system. And it takes a little bit of time. I would say up to 3 months. It's working up to 3 months because
Yeah.
it takes some time for your lymphatic system to take those dead fat cells and get them out of the body. Here we go. Here's some cool sculpting befores and after. On the top left, as you can see, it's the arm fat. And the one that I think a lot of women have is their inner thighs. It's just such a difficult area. And as long as there's a bulge that you can actually put the handpiece on, where it's not too long, you can treat it.
Definitely.
And then the lower abdomen is always a good area to treat.
I think that's like our most popular area.
I think the flanks are as well.
Yeah.
The flanks and the abdomen. And here you go. Some more before and after treatments. The one on the right is somebody that I've known for a long time, and we did too large on her lower abdomen. She, in addition, lost some weight. Because what happens is as you feel like, you see the reduce in fat, you actually want to lose weight, and you feel like you look good. And I feel like a lot of people end up losing weight afterwards because they started to see it on their body, and then they end up trying to eat better and trying to exercise.
Of course, you're investing in yourself, and you definitely don't want to go backwards and eat junk and not put in the work on your part. Cool sculpting can give you the best results, but you have to help it as well.
So the areas that can be treated,
so
we discussed, go ahead.
Stomach, abdominal, thighs, arms, love handles and flanks, the back bulge and the bra area. I love treating that area. I don't know why, it's like my favorite. Under buttocks, which is the banana roll, double chin under the neck, and a male chest.
So this is how the cool sculpting works. It's actually known as cryolipolysis. So you put these 2 panels of the handpiece in. It actually sucks in the fat, and it gets cold enough where it actually kills the fat, but it leaves the rest of your body intact. So nothing happens to the fat, to the skin, because fat freezes at a much lower temperature than anything else. So it's like when you make sauce or you make soup and you keep it on the counter, or if you put it in the refrigerator, the fat rises to the top because it freezes at a much lower temperature than anything else. So then it just dies off. So actually this month in July, you could save 20% on cool sculpting.
Yeah, that's a really good deal. Our Emsculpt Neo. So I know a lot of people have heard of the Emsculpt, but this is the Emsculpt Neo. So the difference with this one is that it has radio frequency. So the Emsculpt before was for muscle toning. Now our Neo is muscle toning and fat reduction. So it's all basically great. And it's only 30 minutes.
I was so excited about this treatment.
So the Emsculpt Neo is the first FDA approved non-invasive body treatment. So you can lose up to 30% of fat and grow up to 25% muscle. And this is ideally for basically anybody who has stubborn fat bulges or just want to tone up, have the flat stomach, but you want that definition. This is great for you as well. And basically, so what it does, so like I said before, it has the radio frequency, it has the high intensity electromagnetic energy, which is the high fem, what we were discussing. And it's just 2 in 1, and it contracts your muscle fibers. So with that as a result, your muscle grows, becomes thicker, becomes stronger. Especially women who've had babies, we end up having that separation with our muscles, and it actually helps with bringing that in up to 16%. So sometimes women feel a little bit wide because of that, but the Emsculpt Neo helps bring that in, and you look smaller and you feel tighter and you just feel great. So that's also another benefit of the Emsculpt Neo.
So here are the areas that can be treated. The abdomen, get a tighter stomach, like Giovanna was saying, when you get that separation of the muscles after pregnancy, diastasis recti, it actually helps to bring that up, actually even 16%, which is very difficult. It's impossible to do that with crunches or exercise or anything else besides an abdominoplasty. There's
Yeah.
no way to fix that outside of that. Well, now we can. It also helps with the buttocks. You can get a BBL
Without getting a BBL.
without getting a BBL. It's
Yeah.
actually awesome.
Mhm.
You could do the arms, the legs, the thighs, the calves. We can actually even treat the saddlebags.
Yes, and also inner thighs.
Yeah, inner thighs.
Mhm.
And here are some pictures of the Emsculpt Neo.
Yeah, I mean, look at that
These are before and after.
plumpy butt. It
Mhm.
just helps so much, and
The lower
the
abdomen.
lower abdomen.
And here are some more pictures. So, I mean, if you have some definition to start with, you'll of course get more definition. As you can see with the second picture, but the first picture he has a gut. So,
Yeah.
so
So it's gonna focus on the fat.
it'll
It-
focus on the fat. Yeah,
Yeah.
exactly.
Definitely, but you can even see some muscle definition coming in of the first picture as well.
Mhm. So we like to do 4 treatments,
Mhm.
7 days apart
Mhm.
for best results.
Yeah.
And it's
So yeah, minimum four treatments, and then it could go up to 6 to 8 depending on your body. And then you could always do like a maintenance, I think, 3 to 4, maybe 2 years down, because you do see the final results 3 months after your last session. So this is radio frequency. Everything takes time. Your body needs to adjust to what's going on, but you will see those results.
mhm. Okay, yeah, so Giovanna already explained how the Emsculpt Neo
Yeah.
works. It works for, I mean, we've been doing it for a while now.
Yeah.
And
Everybody loves it.
everybody loves it.
Yeah, we have it in our city location right now at the moment. And patients just, after I think their 3rd treatment, they start noticing a difference. And like I said, it does take 3 months after your last session to see the final results. But the fact that they're already seeing some tightening, some definition, it's just amazing. And that's only every 5 days that they come in. And it's just one of our favorite treatments in the city.
Good. We're getting a new machine into the city office right now. Actually, we can actually bring it back and forth. It's the Morpheus. And the Morpheus 8 is a microneedling device that's for the face and body. And what it does, it helps to reduce some fat and tighten skin. It's great for people who have loose skin.
Yeah.
Like if you see people have that crepiness on the arms, that's very difficult to treat with anything. It helps also with some stretch marks.
Cellulite as well.
Cellulite as well. It helps to remodel the fat that's on our legs. So when we have fat on our thighs, sometimes it's a combination of loose skin and cellulite. So when it's loose skin, you need some tightening, and the Morpheus will help tighten that skin, as well as kill some of that fat, and it works great.
Yeah.
So here it is. It's a radio frequency that actually just remodels and just helps to contour the face and the body, because it makes these it actually punches these little needles down into the fat layer of skin. So it actually helps to regenerate and remodel that fat layer. So it'll make it appear smoother. It'll make it appear less dense, and it'll help to tighten the skin.
How would you say patients would experience this treatment, like the day of? Like I'm just want to so patients know numbing wise.
Yeah, we numb you before the treatment. We just put it's a special numbing that we have, which is different than what we have on for injectables. And it'll just, the treatment is actually quick, but we numb it with a different numbing cream, so it's not as uncomfortable. And we treat the area, and it's basically a quick treatment. And depending on how large the body size is, anywhere from like 10 to 10 minutes, 10 to 20 minutes.
Yeah.
For each area, you know, hands-on. We numb you for longer than that, but the treatment itself is pretty quick. Here are some before and after of Morpheus.
Yeah, so this is crepey skin. This is like that thin skin. So people who come in and say, you know, I'm interested in Coolsculpting. I have this area that I don't like, but there's no fat there. That's basically skin. And that's when the radio frequency with the microneedling with radio frequency comes in, because what it's going to do, it's good, like Louisa said, it's going to puncture it, and it's going to send those radio frequency waves down to help tighten that skin and build that collagen back.
And radio frequency actually goes much, much deeper than any laser does. So if you look at the spectrum of lights, there's radio waves, and then there's different light waves, and then all the way at the end is radio frequency, and that goes the deepest into the skin, and it actually protects the skin too. So you could do it on darker skin types, whereas lasers you really can't do a darker skin type without having any complications. Here's another one that Giovanna was saying helps with cellulite, but this is also a combination of looseness, loose skin, and cellulite.
Yeah.
So if you just treated just the cellulite, you're not going to get as good of a treatment, because you're not treating the looseness of the skin. That's what I need. I think you're going to have to do that to me. Here's somebody with stretch marks. Stretch marks are so difficult to treat.
Yeah, especially because of discoloration. But I mean, this helps with discoloration as well.
Yeah, it helps with the redness. In the past, there was we did Fraxel on it, but Fraxel helped with the depth of the
stretch marks.
Marks, or we could treat it with a V-beam, which helps with the redness. But this is actually a 2-in-1. It helps with both. And there was also that carboxy therapy, which is like this little needle with this oxygen therapy, which was, you needed so many treatments, but this is like the newest thing for stretch marks. And it really does work very well.
So cellulite. So basically what cellulite is, it's a fibrosis band that goes in between like our skin and our fat cells. And it just, so it's basically our bands weakening as we get older. Of course, we start to lose collagen and those bands become weak, and they make those little depths in our skin. So that's what you see. You see those little pockets of it's actually bands. But we also, so not only does Morpheus 8 help, we're gonna get into what else can help with cellulite itself.
Yeah, and that kind of cellulite, nothing really helps. I mean, we had things that we're going to talk about this that they've had in the past that helped it, but it really didn't take the cellulite away. So those elastic bands are those bands are actually pulling the skin down, and that's what causes that little dimple. So this is what some of the things that we've used in the past was weight loss, exercise, which, you know, you could be skinny and have a lot of cellulite. It doesn't necessarily mean that it's fat. It's just fibrous tissue. Lymphatic drainage and dry brushing, they used that in the past. And it really just, it was such a minimal improvement. And if it did improve somewhat, it actually just, it was a very temporary fix.
Yeah, this is something that you want to hit at all angles. Like when you come into our med spa, we are going to give you a treatment plan, and we're not going to sell you on one thing only unless you just benefit off one thing. But for instance, you know, let's say patients come in for Emsculpt or Coolsculpting, I tell them in 2-3 weeks they should get a lymphatic massage just to help with the draining of their lymphatic system to remove all those toxins. So they may need Cellfina, which is an injection for cellulite, and also our new injection called Quo. And, you know, just injections, Morpheus 8, Emsculpt, all that stuff, it's just going to help and give you the best results depending on your issues.
So we're going to customize the treatment depending on your needs. So some of the things that can help, like your lifestyle and tips, are Eating more vegetables
good, yeah.
helps. An intakes a higher intake of water because it kind of helps flush out those toxins in your body.
Amino acids,
Mhm.
definitely. Just choosing the right food for you. As you know, how it says here, it says, if you up your gelatin, bone broth, nuts, fish, vegetables. Vegetables are always great. Avoid carbs, of course. Anything bubbly is not good. Sugar is not great for you. And then, of course, exercising. That's to tone muscle and help.
To help reduce the appearance, but it's not going to take it away.
Yeah.
It'll just improve the texture of it. Same thing with lymphatic massage. Lymphatic massage actually help to remove toxins out of the body, so that the dimpling doesn't appear as deep.
Yes, yeah.
Yeah.
So lymphatic massages are just really good. A lot of people think that they need surgery in order to get a lymphatic massage. You could get a lymphatic massage even if you never had surgery. It's just, you feel good. A lot of people see actually some difference after. They feel tighter, they feel more defined right after. Our massage therapists in the city and in Great Neck are really great
Yeah, they're
and
amazing.
helping you with whatever your concern is. They're definitely going to talk you through it and help you. And it's not, I wouldn't say it's a massage
Yeah, no,
because
but
it's
it's
not
still-
comforting,
yeah.
but it's effective.
Yeah, but it's really, as we were saying, it's not really the solution for cellulite.
Yeah.
Mhm. Dry brushing as well. I mean, this is what they used to use to help with cellulite. It just to help stimulate your circulation in your lymphatic system.
Yeah.
Which does help, but it doesn't take it away.
So now we have our glow injections. So
These are actually one of the only things that, and it's the newest thing that we have out, and we were one of the first practices in New York to have it. So you basically need 3 treatments, and you'll see the result in 10 weeks.
yeah,
The first treatment, you're gonna have a lot of
bruising.
and each one after that, you'll have less and less. But what you're actually doing, those bands that we were talking about, we inject into that bands in different directions, and it actually helps to dissolve those bands. So instead of being like this, it actually dissolves those bands so they're not touching each other again. So it's not gonna pull that skin down anymore. And do you wanna share your experience?
So yeah, so I got Quo. It definitely helped. My area, which Quo is more beneficial for butt and thighs, upper thighs, but mostly on the butt area, and that's where I mostly had it. I just had really deep ones, and it's really helped. My experience with Quo, I had no pain. During the injections, it was painless. It was really quick. I think you have to like stay laying down for like 3 minutes right after they're done, and then you could get back up and go on your day. I did feel it after, like stimulating, and then when I looked, I was like, okay, I'm already bruising, which is normal because we walk you through it and we tell you exactly what you're going to be expecting. Bruising goes away within a couple of days, and then you're waiting for the 3rd week for your next session until you're finished with all 3 treatments.
So one of the models that we did actually called me up, and she was sore, like on the ride home. But it's really nothing like cellulite.
Yeah,
which is surgical.
Yeah, like it's not like you couldn't feel, like you said. I think my 3rd injection, that was when I felt it a lot sooner. I guess my body became accustomed to it. The first one I was fine. The second one I felt, a little bit of a soreness. The 3rd one was a little bit more intense, but it went away pretty quick.
Yeah, but the results are amazing.
Yes.
Which will show you some slides. Here we go. Here's somebody that had 3 treatments. She had really, really deep cellulite. And in 3 treatments, that's a huge
Yeah.
difference.
That's amazing.
Can she use a little bit more? Yeah, just on the left side, absolutely. But overall, it's much smoother. And she even said when she puts on pants, stretchy pants,
Yeah.
it looks much smoother from in her pants as well.
So how does it work? So Quo actually contains collagenases, and those enzymes are targeted for those bands that Louisa was talking about. So it actually kills cellulite by releasing those bands. So once that band releases, your skin goes back, pops right back out.
It dissolves those bands so that it's not pulling again.
Yeah.
And
More
here's some more
photos.
before and after.
The left one's me.
Yeah. Not gonna say that too loud. Here we go. Another one is Cellfina, which we did for a while, and you basically what they do is they put this, they mark the cellulite, and then they put this kind of like suction thing in there, and they actually sever, they cut those bands through this little tiny little injection into it. So it's non-surgical, but you are entering the body, similar to Quo, where they're injecting it, you're entering the body. Instead of injecting, you're actually cutting those bands, so it actually releases the band, so it's not sticking together anymore. And you can resume normal activities within 24 hours. Bruising for that is the same thing.
Yeah.
You're bruised a lot for that one as well, but then it goes away rather quickly.
Yeah.
And then I'm gonna go to the next. Okay. Now Cellfina works as I just said. It actually we put the suction on, and it actually pulls the cellulite band up so that you can actually get in there and cut those bands. And it's done in the office, less than an hour. It works pretty well. It is a little bit more invasive and a little time consuming. And since we've been doing the Quo is so much easier, faster. It's done quickly, and it's just much easier. It's more effective, I think, right?
Between Cellfina and Quo, depending on what we would recommend for you, but I think we're like Quo Pro here.
Quo Pro. Here's some before and after of Cellfina.
Yeah.
And Cellfina, I find that you really can't do Cellfina when there's so much of it, so many little dimples next to each other. They actually kind of have to be isolated, sort of like they are here, as opposed to the Quo, where you can actually, they're everywhere, and then you can actually inject multiple areas close to each other. Whereas the Cellfina, it's hard to do that with the Cellfina. There we go. And here you go. Here's another Cellfina.
It's really nice. 6 months after.
6 months after.
And
there we go.
Yeah, we're all done.
We're all done. So we have a question here. Let's see. What is the best way to treat postmenopausal weight gain in the abdomen? Yeah. Postmenopausal, I would probably start with the Nouveau diet, because the Nouveau diet helps to detoxify your body as well. So it kind of resets your hormones so that you're not holding on to that weight. So even if you're eating well, eating healthy, you try and diet and it's not working for you, I find that the Nouveau diet just helps to reset your hormonal levels, so that it'll make it much easier for you to gain weight. I mean, it's not the easiest diet, but it works. It's the most effective.
It is.
And it's a 40-day program, and you could do anything for 40 days. And
also it helps with that. We have a lot of patients come in with that hard stomach and thinking that they are qualified for Coolsculpting or Emsculpt. But that's when Nouveau comes in.
Because that's visceral fat.
Yeah, that's visceral fat. So visceral fat is fat that's in between our organs, and that's that hard belly. So if you can't grab it and it's not soft, then Coolsculpting won't be
not-
for
is
you.
not for you.
Nuvo is
Mhm.
definitely the best way to go start off, of course.
Yeah. So the next question is, what is better, Coolsculpting or Emsculpt?
I think it depends on the
Yeah, it
person.
really depends on the person.
We love both.
Yeah, if you have a lot of fat, I think the Coolsculpting helps to debulk.
Yeah.
If you have a little fat that you just really want to build up muscle and have more definition, the Emsculpt is better for you.
Yeah.
So yeah, so it's a customized thing.
Yeah.
And sometimes we start off with Coolsculpting and then
And
we
then
can
end
end
up-
with Emsculpt.
Yeah.
But it's really, all of our treatments are tailored for that person.
Yeah, we can't really say
Yeah.
which one's best. It all depends on the person and the treatment plan that we design for you.
Yeah.
So does drinking soda make my cellulite worse? I feel like that, so cellulite, everybody thinks that's fat. It's not what we were explaining before. It's not fat. It's literally the band. It's our weak bands. And does weight gain and weight loss affect that? Yes. But does it make it worse? I mean, it doesn't help.
Well, it's processed. The
Yeah.
processed foods does hold on, they give toxins to
Yeah.
the body, so it can actually make it worse, I think. But it's not. It's just hereditary. I think.
Yeah, I think it's
Cellulitis.
definitely
And
genetics.
some people just have it and some people don't. It's just like veins. Some people are just, they get veins on their legs and some people don't. It really just, it just, everyone's different. Yeah,
Yeah.
yeah.
Does anybody have any
Any
more
any more
questions?
questions for us?
So do not miss out on our Coolsculpting 20% off. How much is per treatment for Coolsculpting? So it depends on the area. If you like, all our consultations in MedSpa are free. So you could definitely come in or you could do a FaceTime and we could talk about how many areas you would need, if you would need a small area, a large area, it depends.
Yeah, so one small area, one small handpiece. It could be a flank, it could be one side of the stomach, is $750 normally. But a lot of times we overlap the area, so a lot of times it's too small. And we also have a large handpiece. So, but like Giovanna was saying, it's a customized treatment and not everybody can put a large on the abdomen because it won't fit on their abdomen. So it's hard to say until we see you.
Yeah. It's better to come in the office to get a quote and see, because you may not need just one little area. You may want to just do everything, do flanks, raw fat, abdominal, thighs.
And also when we look at a patient, we want to treat the whole area. So you want a more hourglass shape. Sometimes you need to do the flanks and the lower abdomen. And sometimes you need to do the upper abdomen. Everyone's different.
Yeah.
Yeah.
But this is the best time, July, to get on Coolsculpting, and you could literally go to work. You could do this on your lunch break. If you have time for it, you could definitely do this on your lunch break and go to work. And I've done Coolsculpting and it's 3 minutes of discomfort. And then after that, you go numb of how cold it is and you're
And that's
fine.
it.
Yeah, you're
Yeah,
perfectly fine. You could go no pain, no discomfort right after. You could go to work, you could go home, do what you have to do, run your errands. Actually, I love this treatment.
Yeah. So anyway, if you have any other questions about any of the treatments that we discussed, you can email us at info@aristocratps.com and we'll get those questions answered for you.
Yeah.
Okay. Thank you for joining us, everybody.
Yes, thank you.
And I hope to see you soon.
Hope you guys have a good summer. Yay.